News at 6 beginning tonight by joining our senior senator from Missouri, Roy Blunt, here live in our studio. Senator Blunt, thanks for being here with us tonight.
Hey, great to be with you, David. Great to be with you, Heather.
So we have several questions we want to ask you. First, let's go ahead and get to that viral video of the Lake of the Ozarks that surfaced over the Memorial Day weekend. A lot of the feedback that we are getting is some people who are frustrated and want life to get back to normal, others who are a little frustrated that there are no repercussions from people not social distancing. What is your response to that?
Well, I'm not in the repercussions business. That's something that local officials are going to have to decide, but you have to use judgment here. I mean, this is clearly a dangerous thing, or tens of thousands of people wouldn't have died. You know, we have 35,000 people on average die from the flu every year. We're going to have 3 times that many people die. Some will be overcounted, some will be undercounted, but clearly this is dangerous. Now, looking at those shots of people at the pool, they appear to be the most safe group. You know, people roughly around college age, 10 years either way, are the lowest death numbers have been right in that group. But it's selfish, just because you might get it and not have a big problem, to assume that the person who you see at work every day, or you go by and see your grandmother or your grandfather and suddenly they're sick. People just have to use better judgment here. This is, the country has gone through an incredible series of ramifications on the economy and on people's health because of this, and people have to take it seriously. If you don't care about yourself, you should care about the other people you have impact on and the lives you could endanger, even if your life is not endangered by bad behavior.
Let's talk about the potential, if there is potential, for a second stimulus package, perhaps more payments to Americans. Is that possible? How might we pay for it? And also, what are your thoughts about hazard pay for some of those essential frontline workers?
Well, I think we're going to have another effort to see what needs to happen. Hospitals still struggling. We've got large sectors of our economy that are still struggling. I don't think all of the programs have worked quite as well as we had hoped they would. Some of them worked better than we thought they would. But we need to take a little time here, David, I think, to really look at what we're trying to solve in June, July, and August, which is a different moment than April and May. Things are changing quickly, and just doubling down on programs that may very well have been the right programs for this month and last month are likely not to be the right programs for what happens next. We need to have better testing. It needs to be easier to take and a quicker response. Kids going back to school, people going to work, people wanting to visit a nursing home, all of those things are going to have to be thought of in a different way than we've been thinking about them.
Now, you've said that there's a perfect storm brewing with how COVID-19 is impacting mental health in this country. What are our leaders in Washington doing to increase mental health care and make it more accessible?
Well, you know, this is something I've spent a lot of time on in the Congress, and National Institute of Health research, something that I think really is going to pay off here in the near term with vaccines and tests and other things. But on the mental health front, one, we need to treat mental health like all other health. 2, if you have a mental health problem, or maybe even if you don't, the percentage is high of people who say they're more concerned about their personal mental health than they were before this isolation started. And we see, I think in Greene County, overdose deaths and suicide deaths are 25% higher than they were last year. At the national distress number run by Health and Human Services, there's a 900% increase in people calling. We're seeing the uptick for the first time in about 3 years in opioid-related deaths again. And you can see why this would happen. You know, suddenly you're by yourself, or you're with somebody else you don't want to be with. You're by yourself. You've lost your support system. You begin to think, okay, I just need something to make me feel better for a little bit. What was that really, and then you think, well, I could probably take those pills again one time and not be hurt, and it just doesn't work that way. And so we need to be aware of people we know who have a behavioral health challenge. We need to treat that like we would any other health problem anybody had, be willing to talk about it, be willing to deal with it. And in Missouri, we've been one of the 8 pilot states some legislation I did with a Democrat from Michigan, Senator Stabenow, Excellence in Mental Health, where we do have dozens of locations in our state where in whatever way you can afford it, you get your behavioral health situation treated just like you do any other health situation. And in this area, Borough Health Center is really the regional person that puts that plan together, and we've been putting a lot of money behind that. And I think as you invest in mental health, the other health care costs that people have go down, and it's logical. If you're seeing your doctor, if you're showing up for appointments, if you're feeling better about yourself, your other health care problems are going to cost less. Probably the financially smart thing to do, certainly the right thing to do, is to be aware of the mental health challenges that this is exacerbated.
Okay, 10 seconds here. Can you talk real fast about how we can make public-private partnership work in terms of speeding up and getting more testing out there?
Well, probably not in 10 seconds, but what we've done is really put a plan together that we're going to take the best ideas out there that the Shark Tank kind of environment thinks will work, go into production with maybe 5 of them, understanding that 5 of them probably aren't going to, by the time you get them produced, have passed all the other tests to be safe and have the efficacy they need. But if you get 2 of them 60 days or 6 months earlier than you would have gotten it earlier, would you gotten it otherwise, it's worth whatever investment you've made to move forward with all 5 of those likely ideas and hope that by the end of this year there's a vaccine available. That's when we really turn the corner on this fight for the economy and against the virus.
Missouri Senior Senator Roy Blunt, thank you for being here. We appreciate your time. All right.